Good afternoon. Governor Cooper has proclaimed May 2022 as Older Americans Month, and OSHR is excited to celebrate this afternoon with our guest speakers, Kathleen Cameron, BS Farm, MPH Senior Director at the National Council on Aging, and Joyce Massey Smith, Director for the North Carolina Division of Aging and Adult Services. They will be discussing ways older Americans can remain in their homes and communities longer, how to live independently, the biggest challenges facing older adults today, how the pandemic has impacted this demographic, mental health decline in older adults, and access to benefits, programs, and resources for older Americans and individuals caring for older adults. Before we go further into today's program, I would like to do some housekeeping. As always, please keep your microphones on mute throughout the entire session. Please send all of your questions to the chat room. The chat room will be monitored, and we will work to make sure your questions are answered in an orderly fashion. This session will be recorded, and you will be able to view this program later on demand. Speaking of on-demand recordings, our Lunch and Learn sessions are available to view, with the most recent addition being the Asian American Pacific Islander Heritage Month program. Last week's and today's session will be available soon, and you will be notified when they are ready to be viewed. May has been a busy month for us, and June looks to be the same way. We are pleased to announce the following upcoming Lunch and Learn programs. June 15th, LGBTQ Pride Month program. And on June the 22nd, we will have our Juneteenth celebration. We look forward to seeing you there. I'm going to turn the program over to Gina Streety, and she's going to introduce today's speakers. Gina?
Thank you, Wendy. I'm delighted to introduce our speakers. We have Joyce Massey Smith. She is the Director for the North Carolina Division of Aging and Adult Services. Previously with the division, she was a Regional Adult Programs Representative, Chief of Budget, Planning and System Support, and Adult Services Section Chief. She also worked with the Region 1 Area Agency on Aging, first as a planner, then as AAA Director. Massey Smith has served in leadership positions in both the North Carolina 4A and North Carolina Association on Aging and Disaster Services at Northwest North Carolina chapter of the American Red Cross. In March 2018, Governor Roy Cooper named her as part of the Interagency Council on Coordinating Homeless Programs. Massey Smith also served on North Carolina Department of Health and Human Services Inclusion Council. She earned a Bachelor's of Social Work from UNC Greensboro, as well as a Master's in Public Administration with a concentration in aging and public policy. Kathleen A. Cameron has over 25 years experience in the healthcare field as a pharmacist, researcher, program director, focusing on fall prevention, geriatric pharmacotherapy, mental health, long-term health services and supports, and caregiving. Ms. Cameron is currently Senior Director at the National Council on Aging, where she serves as a subject matter expert on health-related topics, oversees the U.S. Administration on Aging-funded National Falls Prevention and Chronic Disease Self-Management Resource Centers, and the National Institute of Senior Centers. Her work supports policy and advocacy efforts at the federal level to improve health care and social service delivery for older adults. Ms. Cameron was previously with JBS International as a director of a substance abuse and mental health services administration funded technical assistance center aimed at educating the aging network, mental health providers, and policymakers about behavioral health conditions among older adults. She has also held positions at the American Society of Consultant Pharmacists Foundation and the National Council on Aging. She has served as a consultant to various aging and healthcare organizations in the Washington, D.C. area. Ms. Cameron received a Bachelor of Science in Pharmacy from the University of Connecticut and her Master of Public Health from Yale University. The topic of her master's thesis was medication use and risk of falling among community-dwelling older adults. I want to welcome both of these ladies, and I turn it over to you, Joyce.
Afternoon, everyone, and thank you for having us here. I am so excited to be celebrating Older Americans Month, and I think that Catherine is going to give you a big and broad picture around issues for older adults and aging in this country. And I'm going to focus on sort of the services and issues and needs that are related to older adults and their caregivers. But before I get into the presentation, I'd really like to say that, you know, most of us in this work have this sense of love and support and place of honor for older adults in our lives. And it's a bigger issue that we really need to work on as we try to help everyone age their way and age with dignity across the state. And oftentimes, you know, our society is looking the other way. And so it's our job at the Division of Aging and Adult Services, in partnership with so many organizations, is to uplift what it means to be an older adult and not only be concerned about the challenges and the needs, but the opportunities that come with aging and the giving that so many older adults have done. And I always say, you know, we're standing on their shoulders. And so it's our time to give back. And as a state employee, one of the things, if I were speaking to you in person, I would ask you to raise your hand if you have ever had the responsibility or experienced family caregiving for an older family member or a spouse or maybe a child with long-term medical needs. And so caregiving is a tremendous asset to what we do for older adults, but it also needs its own attention related to our caregivers. And so what we're talking about is things that caregivers do on a regular basis, is making sure that folks are taken care of, their emotional support, care, safety, managing serious health conditions. And so caregiving is a big deal. And so many of you, I expect, have done that or will do that. And what I want to share with you today is about resources and information to support family caregivers, because there's no way that, nor would we want it, that public dollars or private insurance could pay for the care and especially the love that's provided by family caregivers. And so there's all kinds of things that caregivers do, from just, you know, being able to check on things to actually doing hands-on care and bathing and preparing meals and depending on the needs of their loved one. And it's a big and important job. And we need to honor that work. So in terms of who are family caregivers in North Carolina, and I expect that this trend follows nationally, is typically is a 49-year-old married daughter with her own family who works outside of the home. And 83% of the help provided to older adults come from family members. And 44% of the caregivers actually live with the person they care for. And surprisingly for some folks, about 1 in 3 family caregivers is over the age of 65. So we have a lot of older adults looking after other family members. And most caregivers are living with the care recipient in the community. And AARP and many others have done this study over and over, is if older adults have a choice about where they live, it is to live in the community and in their own homes. And so that's something that we work every day to honor, is that choice about where I live and who I live with. And so why do family caregivers do this? Most is because of they desire to help that family member stay at home and being close to that person if they have particularly early onset dementia. And they really, see that it's their responsibility as a family member to care for that person. And we see dementia here, and I won't go into this definition, but dementia for older adults is a growing problem and issue more and more in North Carolina and in the country. And we're trying to pay attention to that earlier and earlier in the life cycle because there are things we can do and there's information we can share with you to protect our brain health and prevent and prolong the impacts of dementia. So I hope that you'll take away from this today is that not only do you need to take care of those muscles in your arms and in your legs and, all that, we need to take care of our brain health. And so people over the age of 65 in North Carolina, we've seen a 16.7 increase in dementia over 5 years. And it's my guess that a lot of dementia goes undiagnosed until it's in the middle to late stages. And the cost of care for nationally, about $1.332 billion in Medicaid costs and Medicare spending. And so we know that about 358,000 caregivers in North Carolina are providing care at the cost of about $7.3 billion a year. And so knowing what caregivers do and knowing that many of you may be caregivers, we have to acknowledge the important contribution that you're making to support older adults living at home and in the community. I'm going to jump through several of these slides but they'll be available to you. I really hope if you need additional information, you'll feel comfortable reaching out to our agency and looking into resources. But there are obstacles for family caregivers, and just want to talk a little bit about that and what it's okay and it's important to ask for help. And I have been a care recipient, a caregiver, and a professional. And I promise you, all the feelings and issues that are listed on this slide are very normal. And caregivers need care too. And particularly with dementia, I think sometimes it's even harder on the caregiver to watch because there's so little that's in your control of trying to help your loved one. So all these things, denying that mama is really sick or guilty that you didn't spend enough time when they were healthier. And for older adults themselves, the loss of independence and dignity, and there's a financial and emotional cost. Resources, if you have to go to work every day and you're leaving a loved one at home and you're very worried about what's going on with them, that can create so much stress. And I don't know if that data is here, but we have it, sort of the cost in the workplace of having to be in a job and trying to perform while also doing that caregiver role. So our division provides several services to support caregivers. We have a state-funded project called Project Care, Caregiver Alternatives to Running on Empty. That supports caregivers. We have federally funded Family Caregiver Support Program, and we also have, we oversee a home and community care block grant that provides direct services to individuals. And you can certainly get more information about that. I'll tell you where to get that in just a minute. We'll have a slide that comes up. So Project Care really is a relief program for persons living, the caregivers serving individuals with Alzheimer's. And we provide vouchers to support opportunities for respite and to avoid, placement in long-term care. And so we've made a huge difference, we think. Here is on our map our partners that you can reach out to for the counties that you live in terms of project care resources and support. And again, that'll be available to you after this. And so we don't have a lot of funding for this, but we served and used, all the funding we had, and we still have people waiting, and this was last year, but the data is still the same, waiting for services and needing care services. We also have the federally funded National Family Caregiver Support Program as part of the Older Americans Act, and it just recognizes the important role that family caregivers play. And we provide support to our 18 area agencies on aging. We call them, they're our AAAs. They're not the auto club that most people think of, but they're the AAA for older adults and their families. And they are an awesome resource to reach out to for family caregiver support program areas, information, assistance in gaining access, counseling, support groups, respite care, and just reach out. We'll have information about the AAAs that you can reach out if you're in need of those kinds of services. And again, anybody providing care for an older adult, 60 or older, is eligible for the program. And next one. Yeah. So here are our area agencies on aging, and you can either reach out directly to them or to our office if you have questions about services and resources for older adults and family caregivers. We have a new program that we're excited about. We launched in 2021 as a result, partially of the pandemic. We've been so impacted by the pandemic that we're still unraveling what it all means and what changes. But one of the things that we were able to do with a federal grant is to create an innovative service for either online caregiver training that's available 24/7 in all 100 counties, and also increased access through our family support program. And what I want you to know about that is that it's an online training program that you can log into, and I've got several slides here. We won't talk in detail about those, but you can access all kinds of caregiver training and information that, whether it be based on a specific situation you're facing at the time, or just for your own learning as you are dealing with issues of caregiving. And I think the next few slides talk about that access, and we call it the North Carolina Caregiver Portal. And you can really in your own home, in your own time, access that in terms of services. And it's through a platform called Trualta. And we have several program modules of training on there that you can, use and do in your own time as you're interested. But our goal is to educate caregivers to know that caregiving doesn't come naturally for our older adults, particularly for our parents. I mean, these are our parents. These are people who raised us and took care of us. And it's a change, and it's a shift, and it's a thing that we have to adjust to. And sometimes it's a real challenge just emotionally. And so making it real and normal through these trainings is very helpful. And also knowing when you've had too much, when you've, really taken on more than you can manage and you need help, you'll find these resources there. And I am watching my time, so you almost. So a big focus is also caregiver wellness, because it's that old saying, if you don't look after yourself, you can't really look after anybody else. And so there's all kinds of support there, things for you to take care of yourself. You have to ask for help, and you have to know that it's okay to ask for help, and that, there are situations where people have grown up in families with a lot of dysfunction, and you might not be the best person to be providing that care because of long-term family relations. It's okay. We need to sort of accept what we can do and what we can't do and ask for help when we need it. Our slideshow is not wanting to cooperate. And I mentioned brain health. It's so important that we pay attention to our own brain health by taking care of our physical self. And we're doing a project with our public health agency under the CDC to really focus on helping people understand that brain health is just as important as any other aspect of our wellness. Another issue that we Kathy will talk about, is safety and support in the home relative to falls. Falls are such a major issue. Our division also oversees the Adult Protective Services program in North Carolina, and we are working to improve protection of very vulnerable adults and services and supports for families. There's so much to be done, and if any of you out there are listening and are interested in being more involved, we have opportunities for leadership in lots of areas related to aging. Yeah, our slideshow is not behaving with us. Okay, that's just more information about the Travolta, and that's, if you log on, that's the homepage you'll see, and you can enroll and again use those modules as many at a time as you'd like. It's all free. And we really want to support family caregivers all over the state. I mentioned earlier that we provide services under the Older Americans Act for older adults to support them in their community and to really focus on those communities and underserved individuals. And this is where the whole issue of health equity comes into play for us, is focusing on older adults who have not been able to access, either through reasons of systemic racism, issues of poverty, issues of folks living in rural areas, and members of our LGBTQ plus community, is that we have to focus on all older adults and their well-being. And so this is just the type of services that we provide through the Home and Community Care Block Grant. And we do those again through our area agencies on aging. We have a Medicaid program not managed by us, but it's called PACE, which is a program of all-inclusive care for the elderly, which is like nursing home care at home. And I think you can tell the trend we're going here is we really want to support people to stay in their home. There are many support groups for family caregivers. Again, they're listed there, and you can reach out to us for more information about those. But if you are approaching or in the middle of being a caregiver, we really want to connect so that you receive the support you need. A lot of other agencies and resources we work with are there for you, and we want to be available across the state to everyone. And one program I'd like to mention is, if you do have loved ones in long-term care facilities, we have both a regulatory arm of our department, but we also have the Regional Long-Term Care Ombudsman, and their role is to advocate for residents' rights in long-term care. And families and community volunteers are a very key part of that. And so if you have issues for loved ones that you're trying to get resolved in long-term care, our ombudsman program is a resource for family members and loved ones. Again, our AAA network, that's a little hard to see there, but you'll have it on your slide. And we want to provide community-based services and supports, but they vary across the state. And we know that public funding for direct services is limited. We are excited about all the things that Governor Cooper has supported in his budgets to improve services for older adults. And also through the American Rescue Plan Act funding, we are able to expand some services and hope that we can build the infrastructure, because one of the things that I don't think I have to say, but it is the reality. North Carolina's ninth in the nation in population, but also ninth in the number of older adults. And currently in our state, we have about 85 counties that have more people over the age of 60 than between birth and 17. And so it means that we have this baby boom is busting, and we have so much opportunity with this aging population, but we also have to prepare for the challenge. And I've got one of our staff members' name here, Dawn Gartman, for Family Caregiver. Our caregiver navigator information is there, and you can contact our division directly for any information or support. And so I think it's time for me to turn it over to Kathy, and then we'll have some conversation after. So thanks, Mindy and Kathy.
Wonderful. Thank you so much, Joyce, for your presentation. And I think what I'm going to be talking about really builds on what you shared. And I want to thank Regina and thank Wendy for the opportunity to be part of this session today during Older Americans Month. And I really love the theme for Older Americans Month this year, which is Age My Way. Because I think all of us, as we age, we want to age the way that we feel is best for us. You know, first of all, the older adult population is not homogeneous. It's becoming more and more diverse every day, and we all have different expectations, different needs, desires as we grow older, and we need to create systems that allow us to age the way that we want to age. So during my presentation today, I'm going to be sharing resources from the organization where I work, the National Council on Aging. We are a nonprofit organization based outside of Washington, D.C. And let's see, Wendy, I'm not able to advance my slides. So maybe you can do it on your end, perhaps. But today I'm going to share with you, what we believe in at the National Council on Aging, a bit about the work that we do that supports local organizations all across the country, including many in North Carolina. We'll talk about the people that we serve, and then I'll go into a little bit of detail about some of the resources that are available for older adults and caregivers across the country from our Center for Healthy Aging and our Center for Benefits Access. But really our vision is that aging with dignity shouldn't be a stroke of luck. We really believe that we need to ensure equitable aging for everyone in our country. And I'm going to show a video now that is from the CEO of the National Council on Aging, Ramsey Alwyn, which I think really kind of sums up our mission and our vision at the National Council on Aging. And in this video, she shares her own personal story of her family, and particularly her father, which I think probably can resonate with a lot of you who are listening today. It's kind of a common story, and it's a story that we want to help address at a national level. So, Wendy, if you want to go ahead.
Yes, I would like to ask everyone to look over on their the panel on the right-hand side, and you should see an area that says multi-video viewer. And if you press play, you should be able to view the video. wanted to interject that I will be attaching the link for the video. So if you did not have an opportunity to see it, but you heard it or both, you will be able to see this video. I'm going to pass it back to you, Kathy.
Okay, thank you so much, Wendy. Well, I hope you all were able to listen to the video. And why aging well matters. Aging well is about living well. It's about staying healthy and financially secure as long as possible. And that's really the main focus areas of the work that we do at the National Council on Aging. And we are working to address systemic disparities based on gender, color, sexuality, income, and zip code that make it impossible for every person to achieve healthy aging or financial aging. We're working to change that. But just to give you, a sense of the demographic realities, really tell the story. And I think you saw some of the North Carolina specific data around that. But as a country, we're going to have 71 million Americans 65 and older by 2030. Yet 75% of them, have at least two chronic health conditions like heart disease, diabetes, arthritis, Parkinson's disease, etc., which really impact their quality of life. And in addition, 25 million older adults are financially insecure. They don't have the means to meet their daily needs. So those are areas that we are focusing on at the National Council on Aging. And our vision is a just and caring society in which each of us, as we age, lives with dignity, purpose, and security, something we all want. And we are measuring our impact. We have a very specific impact goal, and that is to improve the health and economic security of 40 million older adults by 2030. And I'll talk about some ways that we are working to ensure we reach that goal. Just very, very briefly, wanted to share with you a little bit about our history. We are the oldest national organization dedicated to improving the lives of older adults. Our work led to the enactment of kind of signature federal programs that we all depend upon today, including Medicare and Medicaid. And we've really set the standard and work and support local organizations like senior centers and area agencies on aging, and continue to support their work in local communities. And a lot of what we've done too over the last several years, we've moved online because our lives have moved online. So some of our tools and resources have done so as well. So I won't go into a lot of detail here because I'm going to be talking about some of these things that we're working on currently. But we do have a very active public policy department team that is on Capitol Hill, ensuring that programs like Medicare, Medicaid, the Older Americans Act continue to be fully funded to continue to meet the growing needs of our diverse older adult population across the country. We have resources, tools, we curate best practices and disseminate them. And as I mentioned, we have a very strong public policy and advocacy department. But if you go to our website, ncoa.org, we have articles and tools and materials for older adults, for caregivers on many different topics, health topics, financial topics that I think would all be, of use to you today as you think about your future as you age. And then we have developed personalized online support tools for individuals to find benefits. I'm going to talk about one of those in a moment. Also, many older adults need support in choosing a Medicare plan, and we've developed tools and resources around that. And we have tools to help people prevent falls and stay healthy and lead a secure life moving forward. So as I've mentioned, our areas of focus are healthy living and financial security. We do a lot of work around helping older adults to prevent things like chronic conditions or falls. We promote the annual wellness visit under Medicare. That is a benefit that is free to all Medicare beneficiaries. It should be offered every year. And it's a free screen that helps to identify problems before, potential problems before they become problems. But a lot of Medicare beneficiaries don't know about that as a free preventive benefit under Medicare that they need to take advantage of. On the financial security side, we have a lot of resources around money management, job training, retirement planning, and benefits enrollment. And we have some, key audiences that we target in the work that we do. So definitely, of course, older adults that are growing more and more diverse, as I've mentioned every day. We really target those 55 and older. And a lot of our resources really focus on those who are most vulnerable, low income, older adults. And we also support their caregivers. And we've heard a lot about caregivers today, so I won't go into too much detail there. And then we have grants from the Administration for Community Living to support the professionals who are working in local communities and providing the programs and services that Joyce talked about today. And of course, the advocacy work that we do. We're always trying to get grassroots, those in local communities to also serve as advocates for older adults. And we affect change through working directly with individuals, working with communities across the country, and then looking at systemic changes that need to take place to allow older adults to age with dignity. And some of that is, really pursuing, societal solutions to address gaps in services and programming for older adults. And I'll skip this slide, but we really, address how we can empower older adults, caregivers, and communities to address their own needs or to address the needs of those older adults in their community. And this is really a social impact showing you that, by 2030, we are going to impact 40 million older adults. And these are the key populations that we work with. Again, those who are most vulnerable, people with incomes below 300% of the federal poverty level, people living in rural communities who often have significant health disparities, lack of access to services, and then people of color all across the country. So a little bit about the work we do at the Center for Healthy Aging. As I mentioned, we have grants to support local communities, and we really focus on health promotion and disease prevention programs. And these are programs that have been shown to improve health outcomes among older adults and caregivers. And many of them have been shown to also reduce healthcare costs. And these programs are offered in local communities all across the country. And North Carolina has a great network of organizations that are delivering these health promotion and disease prevention programs. And some of them focus on helping older adults and caregivers manage chronic illness. Others are physical activity programs. There's an array of falls prevention programs. Joyce mentioned that. Falls among older adults, they're the leading cause of injury and the leading cause of death by injury among older adults. About 1 in 3 older adults will fall every year, and about 20% of those who fall will experience some type of injury, like a hip fracture, a broken bone, or a brain injury. And oftentimes the outcomes for those who have fallen and sustained an injury are pretty significant, leading to nursing home placement, and for many older adults leads to death. So in addition to the falls prevention, physical activity, chronic disease management, there's also a number of programs that address things like anxiety, depression, substance use disorders among older adults that are being offered, as well as brain health that's so important that Joyce mentioned. Also at our Center for Healthy Aging, we support the network of senior centers across the country. And there are about 10,000 senior centers and communities across the US. And maybe Joyce, you can share a little bit after I finish about how people can connect with senior centers in North Carolina. In some states, it's through the AAAs, through other places, it's through local municipalities. But senior centers are really hubs for older adults that offer these types of programs that I just mentioned that address health issues. But they're also a place where seniors can go and socialize with others. We know that the pandemic had such a negative impact on so many older adults across the country because of the isolation, because of the loneliness that they experienced. And these senior centers are now opening up and are really great places for older adults to engage with other older adults. Many of them, most of them offer meals, congregate meals. And for some older adults, that might be the only hot meal that they receive every day when they go to a senior center. So I wanted to also share with you on the next slide where you could find out about these programs in North Carolina. So this website, which was created by the University of North Carolina at Asheville, this is where you can actually find out what evidence-based health promotion, disease prevention programs are offered in local communities in North Carolina. You can sign up for these programs directly through this website. So it's healthyagingnc.com. And these are great for both older adults themselves as well as for their caregivers. Next, I wanted to talk about our Center for Benefits Access, which connects older adults with benefits all across the country. We support local organizations that are sort of the physical place where older adults and caregivers can go to find out what benefits they might be eligible for. But we also support, we provide grants to what are known as benefits enrollment centers. And there are two located in North Carolina, one through the Council on Aging of Buncombe County, and then Duke University's Division of Community Health, Department of Family Medicine and Community Health. So I provided the contact information for you here. So these are places where older adults and caregivers can go to find out and get assistance in applying for federal, state, and local benefits. They're really just an amazing resource in communities across the country. So hopefully this will be a value to you as you think about family members who might need some extra support. If you aren't able to go to those local places, there are only two, and well, maybe Joyce can share about perhaps others across the state that are doing this. But at NCOA, we have also created what's known as Benefitscheckup.org. And this is a free service that anyone can go to find out about what benefits they're eligible for and to help them kind of get started on the application process. So this includes federal, state, and local benefits. So it includes things like how to find out about SNAP benefits to help to pay for food. You can find out about local housing support or local, heating, LIHEAP, heating, electricity assistance that might be available. But also you can find out about supports for paying for things like the Medicare premiums or paying for prescription drugs. So this is a great, great resource to get started on benefits that for many older adults, they don't even know that they're eligible for a wide range of benefits. So definitely check this out. All right. So just a couple of other things I wanted to mention to you before I close. Another area of work that we're engaged in at the National Council on Aging is we are one of the national offices for the Senior Community Service Employment Program. This is a program that's funded through the Department of Labor at the federal level. and it provides training and employment opportunities for low-income older adults. So this could be for an older adult who is re-entering the workforce later in life, or it could be someone who has retired perhaps and has realized that they don't have enough income to live, and they need to find a part-time job, but maybe they need to brush up on some job skills. So this is a really a wonderful program, and we do run an office out of Rocky Mount, North Carolina, and I can share the contact information for that. But this office supports, I think, 30 different counties across North Carolina. So if you know someone who might, fit the description of needing some part-time work or needing some job skills training, that's the type of program that that would be right up their alley. Another program that we've developed is called the Aging Mastery Program. And as people think about retirement, they may be wondering, how do I actually prepare for my retirement? Well, the Aging Mastery Program from NCOA is kind of that roadmap to help prepare. It's a 10 module program. It's offered in local communities, including some in North Carolina, but we also have it as a book, kind of a self-study book. And it goes over topics like the importance of exercise, nutrition, financial planning, advanced care planning, and the importance of community engagement and healthy relationships as we age. So I just wanted to mention that as another type of program or service that we have at the National Council on Aging. And again, our website, ncoa.org, has information about the Aging Mastery Program, as well as the Senior Service Community Employment Program. So thank you.
Yes, so Kathy, I think we matched up pretty well in terms of covering the issues. I think that the statements about aging with dignity and respect should not be a stroke of luck really speaks to your organization's mission and ours as well, is that aging is part of the life cycle, and recognizing that we have to learn to be our age, just like you talked about the mastery plan, but it doesn't mean, that we are put out to pasture, but that there's a wonderful resource in our communities if we just take a look. And so I appreciate that message from you very much, and something that we have to work on every day.
Absolutely. Couldn't agree more. Thank you.
I don't know if we have questions in the chat. It looks like we have about.
Well, we want to go ahead and start with the chat, and
Okay.
who's going to check with you, Gina. Unless you, both Kathy and Joyce, you want to continue to have the conversation. For time's sake, we may roll into checking the chat and seeing if there are any questions. And I'm going to turn it over to you for a second, Gina, so that I can look and see what kind of questions are out there.
I just sent one to you, Wendy. I don't know if you saw that, but someone sent me a message and asked if the Center for Healthy Aging program that Kathy was covering, is that only for retired people, or do you have to be a certain age to take advantage of some of those programs and benefits?
Many of them are offered to those under the age of 65. I know, and we're seeing more and more caregivers being offered those programs. Joyce, in North Carolina, like through Title 3D of the Older Americans Act, which is the primary funding source for those programs in most states, I believe there is a cutoff age of, is it 60?
Yes, that's correct. Yeah.
60 that they have to be. We're also seeing more and more of these programs being offered online now. many organizations moved from in-person delivery of the programs to virtual or remote delivery through platforms like WebEx and Zoom and others. And I think that's opened up the programs to more and more people of all ages, because many of them were developed not just for older adults, but for other population groups as well. Like the chronic disease self-management education program. So I think the best thing, for someone in North Carolina to do is, check out that website, and find out if they're eligible to join one of those programs through that website, or contact Joyce, probably the local AAA. Is that right?
Absolutely, that's correct. And for caregivers of older adults, that opens the door for a lot of services. Well, if you are caring for an older adult, so checking out those resources as well, I think would be helpful.
And Joyce, I wanted to ask you too about senior centers in North Carolina.
Yes.
Are those connected with the AAAs in your state? I should know it, but it varies so much from state to state.
Sure. No, yes, they are. And they receive funding through our division for operations under the Older Americans Act. And we also have a very aggressive, or I guess challenging sort of certification process for the senior centers, so that we can ensure that the funding that we provide is really delivering, what's needed by older adults in the community. And during the pandemic, we made it a requirement that senior centers develop virtual programming so that folks could access it. And part of our effort, during the pandemic has been, you can't just give older adults a tablet. It doesn't work that way. And so we have been trying to develop education and training when folks to be able to use digital devices. And we've also working with leadership in state government and some universities around how to teach and support older adults in using digital access. And then, of course, the governor has a huge initiative, which I know many people across the state are looking forward to, is full broadband access, because there are some communities who just don't have that access. And so that whole piece of equity is so important in being able to access resources.
Absolutely. Yeah.
Okay, I'm seeing some questions from the chat. I'm sorry. Did you have a question, Kathy?
No, I was just going to say too, I really think, in addition to equity issues related to access to technology, the actual devices, as well as broadband, I think the Aging Network, AAA professionals have done such an amazing job of teaching older adults how to use the technology too, having that technology literacy that's so important for everything now, including, telehealth. During the pandemic, more and more healthcare was provided through telemedicine and telehealth, and that's going to continue. It looks like many of the flexibilities that the government has allowed during the pandemic, that's going to continue after the pandemic subsides, or evolves, I should say.
Absolutely.
I wanted to say, Kathy, you took my question, because I was going to ask about digital equity and the digital divide, and how that's been the effects of that on the pandemic, if it was to our older adults to their benefit or to their detriment. But I do see a couple questions here. Is there an income limit to participate in the programs that we have in the state of North Carolina?
There are some benefits programs, such as what we've called food stamp programs and Medicaid, that there are income limits. But for all the services that I've talked about today under the Older Americans Act, there is no income limit. Usually the criteria is a person age 60 and needing the service or wanting the service. And so many times we run out of those dollars, but there are no benefit, no eligibility requirements around income and resources, except for those that are particularly federally run.
Okay, that's very good to know. And I'm getting a lot of feedback from everyone. They said that the information that both of you gave out was very good, and they wanted to get copies of your slideshows. And we don't get a lot of requests for our slideshows, so you're going to be one of our first groups to get the slideshows sent out, in addition to the link for the video. So we will be sending out the slideshows as well, because they do have all of that valuable information in them. So everyone will be able to access that information from the slides. And is it possible that only one senior center, that there's only one senior center per county in North Carolina?
No, we have a few counties that do not have. I think right now we have well over 100, but some larger counties like Mecklenburg have 2 or 3. And it's not a mandated program to have a senior center, but we will work with communities and organizations to start that and to develop that. And sometimes location and resources are certainly an issue, but if there are communities that don't have a senior center, we will certainly work with that region and that county to try to see what we can do to make that happen. But it's not a mandated thing. Yeah.
Okay. And where do you advertise your information to the public, both of you, about your organizations?
Sure. Ours is on the North Carolina Department of Health and Human Services website, dhhs.nc.gov, and you just click on aging and you will get connected to all of our resources.
And for the National Council on Aging, our website is ncoa.org. And the way that the information on our website is organized, it's information for older adults, for caregivers, for professionals, and for advocates. So if you're a caregiver, click on the caregiver section, and that'll bring up resources that we feel are most important for caregivers to know about, but certainly explore other areas of the website.
You did say the Aging Mastery Program is a 10-module program.
Yeah.
Is it a self-complete program?
Well, I can get some more information out to you to find out where it's being offered currently in North Carolina. I don't have that at my fingertips, but it's when it's offered in person, it's a 10-week program, each week covering a different topic. But we do also have it available as a self-study. It's a book that can be purchased through Amazon. I can send you the link to that too, Wendy.
Okay, I will definitely include that in all of the information I'm going to get out for everyone when I do upload this one to be able to view on demand. Also, I see another question here about older individuals that are age 75 and older that don't have technical skills. Where can they go and get some different training to be able to view websites and things of that sort, and learn how to use their phones or other types of devices?
Sure. I would start if you have a local senior center, I would start there. Many times libraries are often very helpful with learning to use technology. And the other place, in many of the community colleges, there are opportunities to learn. But I would reach out to the senior center if you have one in your area. And if not, reach out to the Area Agency on Aging. And we put that map there for which we have 16 in North Carolina and for the counties that they cover. And they can connect people to the resources. And we do have really strong partners like AARP that are working on this issue. So they're a resource, and they're community leaders. But you start with a senior center, and then if you don't have a senior center local in your community, reach out to the AAA that covers your county.
Okay, well, I am going to take this opportunity to thank both of you, Kathy and Joyce, for coming today and presenting to us, because our older adults in our communities, they are living and walking treasures, and we treasure each and every person that's around us, but especially our elders. And I'm just so glad that we had you here to tell us about all the wonderful resources that we have across our state and also across our country that could be used to help uplift and empower our older Americans. And on behalf of the Office of State Human Resources, again, I'd like to thank you both for coming out and speaking to us today. I'd like to encourage all of you to continue to celebrate older Americans, older adults or Americans Month. And don't just make it the month of May. You should make Older Americans Month something that happens each and every day. And again, I'd like to thank all of you for attending this event, and we'll look forward to seeing you at our LGBTQ Pride Month presentation. This will conclude our program. Thank you, and have a good afternoon.
Thank you.
Thank you. Bye-bye.
Bye-bye.